Thanks so much, and it's great to see that Richard have already said that there's no evidence in primary prevention in congestive cardiac failure and, much more importantly, in patients with renal failure. Statins aren't a miracle drug, and let's see exactly what's going on. That's my disclosure.
We live in a fallen world, but just because I breathe corrupt air and rub elbows with corrupt men, never make the mistake of thinking that I am corruptible.
I won't make that mistake.
Now, that's the great statin scam. Time to clean up the mess. The Sir Rory Collins dispute and a call for an inquiry. Oxford had fallen. Sir Collins, the most statin influential researcher, had received in excess of 100 million from companies that manufacture statin drugs. Collins sold Statin Smart to Boston Heart Diagnostic, and Oxford University received in excess of 300,000 for its sale. I don't mean that you took a penny out of that, Richard.
We've been told that medications to lower cholesterol will save lives.
We repeatedly hear from patients that their doctors tell them, if you don't take this, you will die.
Over 40 million people worldwide take drugs to lower their cholesterol. But now there's evidence that the majority of them won't benefit.
None of those people are less likely to die.
Of course they're going to try to minimize the adverse events because that will increase the sales of their drugs.
And it's a fact, it's certainly scientific fraud, and it's a fact, it's organized crime.
So this is the Hunt-2, and what showed that unacceptable error in cardiovascular risk of all clinical guidelines recommend that clinical and public health recommendation regarding danger of cholesterol should be revised. This is especially true for women for whom moderately elevated cholesterol is not only harmless but even beneficial. An expert review about statins stimulate atherosclerosis by suppressing vitamin K2 synthesis and enhancing arterial calcification. Statin increase coronary heart disease, early onset diabetes, carcinogenicity, tetragenicity, central and peripheral nervous disorder, rhabdomyolysis, and hepatic injury. Moreover, statin use is a marker of quality of access to care, and what we found that 75% of patients stop taking statin after 5 years. Is mortality benefit among those with highest LDL due to stop statin treatment or their high LDL? Moreover, what we find that there's no scientific evidence for the use of statin in any primary prevention trial or patient above the age of 60, not even 75. And what we have seen in the recent publication that no benefit to any patient older than 75, in contrast to what Richard have shown us. And promotion of statin treatment by that statement is risky in prevention of cardiovascular disease and do plenty of harm. And elderly people with high LDL live longer. So why are you going to lower it?
Studies have consistently shown that cholesterol-lowering statins actually increase the amount of calcified plaque in the arteries. Ironic for a drug that's supposed to prevent heart disease. The Veterans Affairs Diabetes Trial found that more frequent statin use was associated with accelerated coronary artery calcification. Another study published in the journal Atherosclerosis found that statins also increase the amount of calcified plaque in healthy people without diabetes. And yet another study published in the Journal of the American College of Cardiology found similar results. These studies have been quietly ignored by the medical establishment and the mainstream media.
And in the Chanty and All Hat and the Irish study found that the lower your cholesterol, the shorter you live. Much more important, statin utilization for primary prevention reduced cardiovascular risk by such insignificant amount as to be arguably meaningless.
I honestly don't believe that doctors do recognize statin side effects, even when they're sitting right in front of them. In the middle of my 2-year illness, I saw my internist for our annual check. After briefly noting that I was seeing several specialists for my dry eye problem, my arrhythmia problem, my colitis problem, and my depression, she then got to the heart of the visit, which was that she was delighted that my cholesterol levels were under control. I find it ironic that neither she nor I ever stopped to question why a relatively young, healthy person had suddenly developed 5 new illnesses in 1 year. And the only new thing in my life was Lipitor.
So more have found that statin therapy increased risk of acute kidney injury by 4-fold higher with Rosovo. Statin use is associated with 50% diabetes mellitus increase. And the FDA adverse event confirmed that statin had disappropriate rate of adverse conjunctive event. It linked epidemic of conjunctive decline, dementia, amyotrophic lateral sclerosis, and motor neuron disease to all types of statin. It confirmed a 10,000-fold increase in amyotrophic lateral sclerosis with statin use. Much more that clinicians should abandon use of statin and PCSK9 inhibitor and instead identify and target actual causes of cardiovascular disease.
Because physicians were not very good at saying, we don't know at times. It's fine for you to shout about the benefits or overstate the benefits of a treatment. The minute you raise concerns that something might not be working as well as it should, you are often criticised, you're told you're unnecessarily scaring patients.
Mr. Chairman, ladies and gentlemen, lipid hypothesis created the war on fat and cholesterol, which commanded 65 years of global human experiment. Statins acknowledge an awful failure, an experiment that has atrocious, unbearable, dire, nasty, shocking, repulsive generational consequences. Thanks so much for the opportunity to present today in New York.